Hello, and a very warm welcome to Silver Inspiration. Today, we are going to have a conversation that is truly vital. A discussion that could be the most important one we ever have together. We're tackling a life-saving topic specifically for our cherished senior community. Have you ever allowed yourself to consider what you would do if a heart attack struck while you were completely alone? It's a deeply unsettling thought, a scenario that can fill us with fear, but it's a reality that happens far more often than any of us would like to imagine. Understanding this possibility isn't about creating fear, it's about empowering ourselves with knowledge. Many of us hold on to the assumption that there will be clear, unmistakable signs, that we'll have ample time to react, or that help will somehow magically appear at our doorstep. But the truth, the hard medical fact, is that the first few minutes of a cardiac event are the most critical. Your actions, the choices you make in that small window of time, can literally change the entire outcome. The good news, and I want you to hold on to this, is that even if you live by yourself, you possess the power to survive. You can navigate this crisis with the right knowledge and a calm, prepared approach. In this video, we're going to break it all down. We will walk you through 7 absolutely essential steps to take during a heart attack when you find yourself on your own. You don't need any complex medical training or fancy equipment, just the power of preparedness and the strength of a calm mind. We are going to build a bridge of knowledge from that first moment of uncertainty to the arrival of professional help, ensuring you are never truly helpless. This isn't just information, this is a survival guide designed for you, for your safety, for your peace of mind. We'll cover everything from recognizing the very subtle, often missed early signs to the immediate actions that get help on the way. I urge you, please stay with me until the very end of this video. The final steps we discuss are the ones that are most frequently forgotten in the panic of the moment. Yet they are the very ones that could ultimately save your life. This dedication to your well-being aligns perfectly with our core mission here at Silver Inspiration, growing older, shining brighter. So, let's begin this journey together. If you find this helpful, please subscribe and hit that notification bell for more empowering content. Our first step, and arguably the most crucial one, is this: recognize the warning signs. Now, when we think of a heart attack, our minds often jump to what we've seen in movies or on television. We picture a person clutching their chest in sudden, dramatic, overwhelming pain. While that can certainly happen, it's not the full story. In reality, heart attacks often begin with a quiet, subtle, and sometimes confusing whisper. You need to learn to listen for a deep, persistent pressure or a squeezing sensation right in the center of your chest. Imagine a heavy weight, like an encyclopedia, being placed directly on you. This sensation is often misunderstood. It might not be a sharp, stabbing pain at all. It could feel more like a profound fullness, a tightness, or an uncomfortable ache that just won't go away. A key characteristic to watch for is its persistence. This feeling might come and go. It might ebb and flow over several minutes. But here is the critical rule. If that pressure or squeezing lasts for more than a few minutes, you must take it seriously. Your body is sending you a signal, a distress call from your heart, and it's imperative that you don't dismiss it as simple indigestion or muscle strain. This is your first clue. The chest discomfort is the classic sign, but your body can send other signals too. Pay close attention to your breathing. Do you suddenly feel short of breath, as if you've just run up a flight of stairs when you've only walked across the room? This breathlessness can occur with or without the chest pressure. It's your heart struggling to pump effectively, which in turn affects your lungs' ability to get enough oxygen. It's a vital sign that something is wrong with the engine of your body, your heart, and it needs immediate attention. Don't just try to catch your breath. Recognize it as a potential symptom. Another whisper from your body is a profound unexplained fatigue. This isn't just feeling a little tired at the end of the day. This is a sudden, overwhelming exhaustion that makes simple tasks feel monumental. You might feel dizzy, lightheaded, or even break out in a cold, clammy sweat for no apparent reason. These are your body's systemic responses to the crisis unfolding in your cardiovascular system. Your body whispers before it screams. I want you to remember that. Don't ignore pressure, breathlessness, or fatigue. Stop what you're doing and act. If this resonates with you, please comment sign number 1 below. It's a common and dangerous misconception that heart attack pain is confined only to the chest. Your heart is sending out distress signals, and those signals travel along complex nerve pathways. This means the discomfort can radiate, showing up in other parts of your upper body. You might feel an ache, a pain, or a strange numbness traveling down one or both of your arms. while the left arm is more commonly associated with heart attacks. The pain can absolutely occur in the right arm as well, or even in both simultaneously. It's a sign that the nerves connected to your heart are firing off warnings. This radiating discomfort doesn't stop at the arms. It can also travel upwards into your neck, your jaw, or even your teeth. I've had patients describe it as a strange toothache that they couldn't explain, or a persistent ache in their jaw that felt like a dental problem. The pain can also manifest in your back, specifically between your shoulder blades. It might feel like a deep, nagging ache that you can't seem to stretch out or relieve. It's easy to dismiss these as simple muscle pulls or sleeping in the wrong position, but in the context of other symptoms, they are red flags. Furthermore, let's talk about the stomach. Many heart attack symptoms, particularly in women, can mimic digestive issues. You might experience nausea, a feeling of intense indigestion, or even vomiting. This is because the nerves that serve the lower part of the heart are situated very close to the nerves of the stomach. When the heart is in distress, these signals can get crossed, tricking your brain into thinking the problem is your digestive system. If you're feeling a heartburn that doesn't go away with antacids and is accompanied by other signs like sweating or fatigue, you must consider it could be your heart. Understanding this radiating pain is about connecting the dots. A single symptom, like back pain, might not be alarming on its own, but when you experience back pain combined with sudden fatigue or jaw pain accompanied by shortness of breath, a different picture emerges. It's a constellation of symptoms that points toward a cardiac event. Your body is providing you with a map of the problem. Don't just look at one street, look at the whole city. Recognizing that pain in your arm, back, or jaw could be your heart crying for help is a life-saving piece of wisdom. Now that we know what to look for, the next part of this step is about mindset. It's about cultivating an attitude of listening with intent. Many of us, especially from generations that were taught to be stoic and not to complain, have a tendency to downplay our symptoms. We tell ourselves, it's probably nothing, or I don't want to be a bother, or I'll wait and see if it goes away. This is, without a doubt, the most dangerous internal monologue you can have during a potential heart attack. Every single minute you spend second-guessing is a minute your heart muscle is being deprived of oxygen and dying. You must give yourself permission to take your own health seriously. Your body is the most sophisticated feedback machine in existence. When it sends you signals like chest pressure, breathlessness, or unusual pain, it is not being dramatic. It is communicating a critical need. Your job is not to argue with the message, but to receive it and act upon it. This requires a conscious shift from dismissal to attention. Promise yourself right now that you will no longer ignore these whispers. Your life is not a bother, it is precious, and protecting it is your highest priority. This internal listening is a skill. Practice it daily. Pay attention to how your body feels when you wake up, after a meal, during a walk. The more you are in tune with your body's normal state, the more quickly you will recognize when something is abnormally wrong. Think of it as being the vigilant captain of your own ship. You know the familiar sounds of the engine and the feel of the deck. When a strange vibration or an unfamiliar sound occurs, you don't ignore it. You investigate immediately because the safety of everyone on board depends on it. Your life depends on it. So, let's make a pact. The next time you feel that unexplained pressure, that sudden fatigue, or that strange ache in your jaw, you will stop. You will take a breath. And you will not say, it's probably nothing. You will say, my body is telling me something and I am going to listen. This simple, powerful shift in perspective is the foundation of your survival. It transforms you from a passive victim of circumstance into an active participant in your own rescue. This is the true meaning of step 1. It's not just about knowing the signs, it's about honoring them. Once you have recognized the signs, once you have listened to your body's whispers and acknowledged that something is seriously wrong, we arrive at step 2. This step is absolute, it is immediate, and it is non-negotiable. You must call 911 or your local emergency number immediately. I cannot stress this enough. There is no room for hesitation here. Do not wait to see if the symptoms subside. Do not decide to lie down for a few minutes to see if you feel better. The moment you suspect a heart attack is the moment you must pick up the phone and make that call. The impulse to delay is powerful and deeply human. We think about the potential embarrassment if it turns out to be a false alarm. We worry about the cost, the fuss, the disruption. Please, I implore you, push all of those thoughts aside. Emergency responders would rather arrive to a false alarm 100 times than arrive too late just once. Your life is infinitely more valuable than a moment of feeling awkward. Every single minute that passes without professional medical intervention, your heart muscle is being starved of precious, life-sustaining oxygen. This is a race against time. and the starting gun has already fired. Let's be crystal clear about what not to do. Do not attempt to drive yourself to the hospital. This is an incredibly dangerous decision. What if your symptoms worsen while you are behind the wheel? You could lose consciousness, causing a catastrophic accident that endangers not only your life, but the lives of innocent people on the road. Your vision could blur. Your chest pain could become so intense that you can't focus. It's a risk that is simply not worth taking under any circumstances. Your car is a mode of transportation. It is not an ambulance. And please, do not ask a friend or family member to drive you either. While their intentions are loving, they are not equipped to handle a medical emergency in transit. They cannot provide you with oxygen. They cannot administer life-saving medications. They do not have a defibrillator if your heart goes into a deadly rhythm. Calling 911 is not just about getting a ride to the hospital. It's about bringing the hospital's emergency room directly to your doorstep. Professionals bring the tools, the training, and the technology that can begin saving your life right there in your living room. This step is your lifeline. Act fast. Let's take a moment to truly appreciate what happens when you dial that 3-digit number. You are not just calling for a taxi service. You are activating a highly sophisticated, multi-layered system designed specifically for moments like this. The person on the other end of the line, the dispatcher, is a trained professional. Their job is to get critical information from you while simultaneously dispatching the nearest and most appropriate emergency unit to your exact location. They are your first human connection in the chain of survival, a calm voice in the storm. While the paramedics are en route, that dispatcher can provide you with life-saving instructions over the phone. They can guide you on what to do next, whether it's chewing an aspirin, unlocking your door, or getting into the safest position. They will stay on the line with you, offering reassurance and monitoring your condition until help physically arrives. This is an invaluable service. You are not alone from the moment that call connects. You have a trained ally, talking you through the most terrifying minutes of your life, ensuring you are doing everything possible to help yourself while the experts are racing to your side. When the paramedics, the emergency medical technicians or EMTs arrive, they bring an arsenal of life-saving equipment and knowledge. They can immediately administer oxygen to help your struggling heart. They will place electrodes on your chest to perform an electrocardiogram or EKG right there on the spot. This test gives them a real-time picture of your heart's electrical activity, allowing them to confirm if you are having a heart attack and in some cases even identify which part of your heart is affected. This information is priceless for the doctors who will be treating you at the hospital. Furthermore, these first responders can establish an IV line, giving them immediate access to your bloodstream to administer critical medications. They can give you nitroglycerin to help open up your blood vessels and relieve chest pain or powerful clot-busting drugs if necessary. If your heart were to stop, they have a defibrillator to shock it back into a normal rhythm. Calling 911 is about bringing all of this power, all of this technology, all of this expertise to you within minutes. It's the single most effective action you can take to increase your odds of a full recovery. We've established the what and the why of calling 911. Now, let's address the biggest obstacle, the if. The internal debate of what if I'm wrong. This single thought is responsible for countless preventable deaths and disabilities from heart attacks every year. People wait. They wait for the pain to become unbearable. They wait for a spouse to come home. They wait for morning. This waiting is a gamble where the stakes are your own life, and the odds are not in your favor. We must reframe this thought process entirely. Think of it this way. A fire alarm doesn't wait for the entire building to be engulfed in flames before it goes off. It sounds at the first sign of smoke. Why? Because early detection and early response are what save lives and prevent catastrophic damage. Your body's symptoms are the smoke detector. Your 911 call is you pulling the fire alarm. It is far better to have the fire department show up and find you accidentally burnt some toast than to have them arrive to a raging inferno that could have been contained. Your heart is the building. Protect it. Let's practice a new internal script. When you feel the symptoms, instead of thinking, I don't want to bother anyone, I want you to think, my health is a priority and the professionals are there to help. Instead of, what if it's just indigestion? Think, it's better to have a doctor tell me it's indigestion than to risk my heart muscle. This mental rehearsal is powerful. By preparing your response ahead of time, you are less likely to be paralyzed by fear and indecision when the moment actually arrives. You will act on instinct, the instinct you are programming right now. This step, calling for help, is your lifeline. It is the bridge from being alone and in crisis to being surrounded by care and expertise. It is the most selfless thing you can do for yourself and for the people who love you and want you in their lives for years to come. Don't let pride, fear, or hesitation rob you of your future. The moment you recognize the signs, your very next action, without a single second of delay, is to pick up that phone and make the call. It is the definitive, life-affirming choice. Act fast, act without doubt. Alright, we've made that critical call to 911. Now, let's talk about the next step, a small action with a mighty impact. This is step 3, chew 325 mg aspirin, but only if you are not allergic and not currently taking a blood thinner prescribed by your doctor. This isn't just a simple pain reliever in this moment, it's a first responder in pill form. When a heart attack begins, it's often because a plaque has ruptured inside one of your coronary arteries, those vital highways that feed your heart muscle with oxygen-rich blood. Your body's natural response is to form a clot, but this clot can grow and completely block the artery, which is a disaster. Think of that clot as a traffic jam in a critical tunnel. The longer the blockage, the more damage occurs on the other side. Aspirin works by intervening directly in this process. It contains a compound that inhibits platelets, the tiny cells in your blood responsible for clumping together to form clots. By chewing the aspirin, you're not just swallowing it, you're kickstarting its absorption. The medicine gets into your bloodstream faster through the rich network of blood vessels under your tongue and in your cheeks. This rapid action is what we need to start thinning the blood and fighting that clot immediately, turning a potential catastrophe into a manageable crisis. This simple, over-the-counter tablet becomes one of the most powerful tools in your immediate arsenal. It's a frontline defense you can deploy yourself while waiting for the professionals to arrive. The key is to chew it slowly and thoroughly. Don't just swallow it whole with water. We want to maximize its absorption rate. By breaking it down in your mouth, you're essentially pre-digesting it, allowing it to bypass the longer route through your stomach and get to work where it's needed most. This isn't just a suggestion, it's a clinically proven strategy that can significantly improve your outcome by preventing the clot from growing and causing irreversible damage to your heart muscle. It's crucial to emphasize the importance of preparation. You should have a full-strength 325 mg non-coated aspirin readily available in your home, your car, and even your purse or wallet. Coated aspirin is designed for slow release to protect your stomach, but in an emergency, we need the opposite. We need rapid release. Having it within arm's reach means you don't waste precious seconds searching for it when every moment is critical. This small act of preparedness, of having the right tool ready, can be the bridge between a devastating event and a successful recovery. It's about being your own first advocate in a moment of crisis. Let's dive a little deeper into the science of why chewing makes such a profound difference. When you swallow a pill, it travels down your esophagus into your stomach. From there, it has to be broken down by stomach acid and then absorbed through the small intestine into the bloodstream. This entire process can take 20 to 30 minutes or even longer. In the context of a heart attack, where we measure time in seconds, that's an eternity. Your heart muscle is being starved of oxygen with every tick of the clock. We simply cannot afford that delay. Chewing the aspirin is our biological shortcut, a way to hack your body's system for immediate benefit. The lining of your mouth, particularly the area under your tongue, is called the buccal mucosa. This tissue is incredibly thin and is densely packed with capillaries, which are tiny blood vessels. When you chew the aspirin and hold the fragments in your mouth, the active ingredient, acetyl salicylic acid, is absorbed directly through this mucosa and into your circulation. It's like getting a direct infusion of the medication straight into your bloodstream, bypassing the entire digestive system. This is why you'll often see other emergency medications, like nitroglycerin, administered as a tablet placed under the tongue. It's the fastest route to get medicine circulating throughout your body. Think of it this way. Swallowing a pill is like sending a letter through the postal service. It will get there, but it takes time. Chewing the aspirin is like sending a high-priority, instant digital message. The information arrives almost immediately. Studies have shown that chewing aspirin can achieve therapeutic blood levels in as little as 5 minutes, compared to the much longer wait time for a swallowed tablet. Those extra minutes are a gift. They are minutes where the aspirin is actively working to stabilize the clot, preserving heart tissue and preventing further damage while you wait for the ambulance to arrive on your doorstep. So, when you take that aspirin, don't rush. Take a moment, place it in your mouth, and chew it slowly but completely. Let the pieces dissolve. It might taste bitter or chalky, but that taste is the confirmation that you are doing something powerful to save your own life. You are actively participating in your rescue. You're not just a passive victim waiting for help. You are an empowered patient taking a scientifically backed step to protect your heart. This knowledge transforms a simple action into a life-saving maneuver, and it's a piece of information every single person should have. Now, as with any medical advice, there are critical exceptions, and it's my responsibility as a doctor to make sure you understand them clearly. The aspirin step is powerful, but it's not for everyone. The most important rule is this: do not take aspirin if you have a known allergy to it or to other non-steroidal anti-inflammatory drugs like ibuprofen. An allergic reaction, which could cause swelling of the throat or severe hives, would only complicate an already life-threatening emergency. Your medical history is paramount here. If you know you have an allergy, you must skip this step entirely and focus on the others. The second major contraindication is for individuals who are already taking prescribed blood thinners. Medications like warfarin, Eliquis, Xarelto, or even Plavix are already working to prevent blood clots. Adding a high dose of aspirin on top of these medications could thin your blood too much, creating a significant risk of severe bleeding. This is a case where more is not better. It could be dangerous. Your doctor prescribed your specific medication and dosage for a reason. In this emergency situation, trust that your prescribed medication is already doing its job, and do not add aspirin into the mix unless you have been explicitly told to do so by your cardiologist. Furthermore, if you have a history of bleeding disorders, such as hemophilia or active bleeding ulcers in your stomach, taking aspirin could be hazardous. Aspirin can irritate the stomach lining and increase the risk of gastrointestinal bleeding. While a heart attack is the more immediate threat, we don't want to trade one emergency for another. This is why it's so important to have these conversations with your doctor during your regular checkups before an emergency ever happens. Ask them, in the event of a suspected heart attack, is it safe for me to take aspirin? Getting a clear yes or no ahead of time removes any guesswork in a high-stress moment. So, let's recap the action plan for this step. If you are not allergic, not on blood thinners, and have no history of bleeding disorders, then chewing a 325 mg non-coated aspirin is a vital step. If you fall into any of those exception categories, you skip this step and focus on the others. Being informed is just as important as the action itself. Understanding not just what to do, but also when not to do it is the hallmark of true preparedness. This isn't about memorizing rules, it's about understanding your own body and your health plan. You've called for help, and you've taken the aspirin if it was right for you. Now, we move to a step that seems incredibly simple, but is profoundly important for your heart's survival. Step 4. Stop all activity and get into a position of rest. Sit down or lie down. During a heart attack, your heart is a muscle in crisis. The blockage in your coronary artery is limiting its supply of oxygen, the very fuel it needs to pump. Any physical exertion, even something as simple as walking across a room or pacing nervously, forces your heart to work harder and demand more oxygen. Oxygen that it simply doesn't have. Think of your heart as a car engine that's running dangerously low on oil. If you keep pushing the accelerator to the floor, you're going to cause catastrophic, permanent damage. The smart thing to do is to pull over, turn off the engine, and wait for assistance. Sitting or lying down is the human equivalent of pulling over. You are intentionally reducing your body's metabolic demand. You are telling every cell, every muscle, every organ system to power down and conserve energy. This simple act lessens the strain on your struggling heart, giving it the best possible chance to weather this storm until help arrives. The ideal position is to sit down in a comfortable chair with your back well supported and your feet flat on the floor. This is often called the position of comfort. It allows your chest cavity to remain open, making breathing easier while still taking the load off your heart. If you feel dizzy, lightheaded, or like you might pass out, then lying down is the safer option. However, avoid lying flat on your back, as this can sometimes make it harder to breathe. Instead, lie on your side, in what we call the recovery position, or prop your head and shoulders up with some pillows to keep your airway open and reduce the pressure on your heart. This isn't a moment for toughness or trying to walk it off. Your body is sending you the clearest possible signal that it is in distress. Listening to that signal and responding with rest is an act of wisdom and self-preservation. Every ounce of energy you conserve is energy that your heart can use to survive. By sitting still, you are actively protecting your heart muscle from further injury. You are buying it precious time and minimizing the extent of the damage. This step isn't passive, it's a powerful, deliberate action to shield your most vital organ when it is at its most vulnerable. Let's explore the beautiful, intricate physiology behind why this simple act of resting is so protective. When you stand or move around, your heart has to fight against gravity to pump blood all the way up to your brain and circulate it through your entire body. This requires a significant amount of work and energy. Your blood pressure and heart rate naturally increase to meet this demand. But during a heart attack, any increase in your heart's workload is dangerous. It's like asking a marathon runner who has hit the wall to suddenly start sprinting. The muscles simply can't handle the added stress. When you sit down, you immediately decrease the physical work your heart has to do. Gravity's pull is lessened, and your large leg muscles are no longer contracting and demanding a constant supply of oxygenated blood. Your heart rate can begin to slow down, and your blood pressure can stabilize. You are effectively lowering the performance expectations for your heart, allowing it to function at a baseline level. This reduction in cardiac workload directly translates to a lower oxygen demand from the heart muscle itself, which is the entire goal of this intervention. We are trying to balance the oxygen supply and demand equation in your heart's favor. Furthermore, getting into a calm, seated position can help regulate your nervous system. Panic and fear trigger your body's fight or flight response, flooding your system with adrenaline. Adrenaline is a powerful hormone that makes your heart beat faster and more forcefully, which is the last thing we want during a heart attack. By consciously choosing to sit down and be still, you are sending a signal to your brain that you are moving from a state of panic to a state of control. This can help activate your parasympathetic nervous system, the rest and digest system, which works to calm the body and slow the heart rate. So as you settle into your chair, focus on the feeling of the support beneath you. Feel your feet planted firmly on the ground. This physical grounding can have a powerful psychological effect, helping to ease the anxiety that is naturally surging through you. Remember that every moment you remain still, you are not just waiting. You are actively participating in your treatment. You are creating the optimal internal environment for your heart to survive. You are lowering its workload, reducing its oxygen needs, and calming the storm of adrenaline, all with the simple, profound act of sitting still. Just as important as knowing what to do is knowing what not to do. In these critical moments, some common instincts can actually be harmful. The first and most important thing to avoid is any further movement than is absolutely necessary. Do not try to finish a task you were working on. Do not walk around the house gathering items. Do not attempt to walk to a neighbor's house for help. Your only movement should be to get the aspirin, unlock the door, and then find a safe place to sit or lie down. Every step you take is a gamble with your heart muscle. Another common but dangerous temptation is to eat or drink something. You might feel nauseous or have a dry mouth, and your instinct might be to get a glass of water. Please avoid this. Firstly, if you become unconscious, having fluid or food in your stomach increases the risk of aspiration, which is when you inhale stomach contents into your lungs, leading to a serious pneumonia or choking. Secondly, the medical team that treats you may need to perform a procedure or administer medications that require an empty stomach. Keeping your stomach empty is the safest course of action for the treatments that lie ahead. And this brings us to perhaps the most critical don't of all: do not, under any circumstances, attempt to drive yourself to the hospital. I cannot stress this enough. It may seem like the fastest way to get help, but it is incredibly dangerous. Your symptoms, chest pain, dizziness, shortness of breath, could suddenly worsen, causing you to lose control of the vehicle and leading to a tragic accident that endangers yourself and others on the road. Furthermore, the ambulance is not just a taxi. Paramedics can begin life-saving treatment, like administering oxygen and other medications, the moment they reach you. Your treatment begins in your living room, not in the emergency room parking lot. By avoiding these actions, you are protecting yourself from additional harm. You are keeping yourself and others safe. The strategy here is one of deliberate, calm, and focused inaction. Your job is to become a stable patient, ready for the professionals to take over. By resisting the urge to move, to eat or drink or to drive, you are making their job easier and significantly improving your own chances of a full recovery. It's about recognizing the limits of the moment and making the wise choice to conserve, protect, and wait for the cavalry to arrive. We've covered some crucial internal steps to protect your heart. Now let's talk about a simple physical action that can make all the difference for the help that is racing toward you. Step 5 is to unlock your front door. It sounds almost too basic to be a life-saving step, but I assure you, in the world of emergency response, seconds are the currency of life. Every single moment that paramedics have to spend trying to get to you is a moment they are not treating you. A locked door is a barrier, a delay that your heart cannot afford. Imagine the scene. The ambulance has arrived. The highly trained paramedics are on your doorstep with their equipment, ready to deploy oxygen, connect an EKG, and administer life-saving drugs. But they can't get in. They have to knock, then pound, and then ultimately make the difficult and time-consuming decision to force the door open. Breaking down a door can take anywhere from 30 seconds to several minutes, depending on the lock and the door itself. These are not just seconds, they are heartbeats. They are moments where your heart muscle is being deprived of precious, life-giving oxygen. This is where you can be your own hero with one simple twist of your wrist. After you have called 911 and are on your way to sit down, if you can safely do so, make a brief detour to your front door and unlock it. Turn the deadbolt, unlatch the chain, make the path clear. This simple act shaves critical time off your rescue. The story of Paul, the 76-year-old we mentioned, is a perfect testament to this. By unlocking his door, he enabled the paramedics to walk right in the moment they arrived. That saved time allowed them to stabilize his heart rhythm faster, very likely saving his life and preserving his quality of life. Think of it as rolling out the red carpet for your rescue team. You are removing the final obstacle between you and the help you so desperately need. It's a proactive step that shows foresight and control in a moment that can feel completely chaotic. If possible, you might even consider propping the door slightly ajar, making it completely unambiguous for the emergency responders. It's a clear signal that says, I'm here, I need help, and I've made it easy for you to reach me. This small gesture can have an immeasurable impact on your outcome. Let's step into the shoes of a paramedic for a moment to truly understand why this matters so much. When they get a call for a possible heart attack, their adrenaline is already pumping. They know the clock is ticking. They are mentally running through protocols and preparing their equipment as they speed to your location. Their entire focus is on one thing: getting to the patient as fast as humanly possible. When they arrive at a locked door, it's a moment of profound frustration and anxiety for them because they know the person on the other side is in critical need. Forcing entry is always a last resort. It's loud, it's violent, and it can be disorienting for the patient inside. It also takes time and physical effort and can sometimes damage their equipment or even cause injury to the responders themselves. All of this is a distraction from their primary mission, you. An unlocked door is the greatest gift you can give them in that moment. It allows for a seamless transition from the front porch to your side. They can enter quietly, calmly, and immediately begin their assessment and treatment. This calm entry also helps to keep you, the patient, from becoming more agitated or frightened. Consider the equipment they are carrying. They have a heavy monitor and defibrillator, a large bag with medications and IV supplies, and an oxygen tank. Navigating these bulky items is challenging enough without having to wrestle with a locked door. By unlocking it, you allow them to bring all their life-saving tools to you without delay. They can immediately begin placing EKG leads on your chest to see what your heart is doing, establish an IV line to administer medication, and provide you with high-flow oxygen to help your struggling heart muscle. Each of these interventions is critical, and an unlocked door allows them to happen sooner. So, when you turn that lock, you're doing more than just unlocking a door. You're becoming a crucial member of your own rescue team. You're communicating with the paramedics before they even see you. Step 6 is all about turning your smartphone into a powerful ally, a tool that can speak for you when you can't. When you're in the middle of a medical emergency like a heart attack, the last thing you want to worry about is fumbling with your phone, holding it to your ear while you're trying to stay calm and follow other life-saving steps. By switching your phone to speaker mode as soon as you connect with the 911 operator, you free your hands. This simple action allows you to do other critical things, like chew an aspirin, unlock your door, or get into a safe, comfortable position. It's a small adjustment that has a massive impact on your ability to manage the situation effectively until help arrives. Imagine this scenario. The 911 operator is on the line, asking you crucial questions about your symptoms, your location, and your medical history. With your phone on speaker, you can answer them clearly while simultaneously moving to unlock your front door. You can describe what you're feeling without the strain of holding a device, a strain that adds unnecessary stress to your already struggling heart. This hands-free approach isn't just about convenience, it's about conserving your energy and focus for what truly matters, your survival. It transforms your phone from a simple communication device into a command center for your own rescue, empowering you to stay in control. Furthermore, keeping the line open on speakerphone provides a constant connection to the reassuring voice of the emergency dispatcher. This human connection can be incredibly grounding during a terrifying and isolating experience. the dispatcher can guide you, offer calming words, and provide instructions, acting as your virtual first responder until the paramedics walk through your door. They can talk you through breathing exercises or ask you to describe any changes in your symptoms, gathering vital information that they can relay to the incoming emergency team. This continuous dialogue helps fight the panic that can so easily set in, keeping your mind anchored and focused. So let's make this a reflex. Practice it now, before an emergency happens. Make a non-emergency call to a friend or family member and immediately switch to speakerphone. Get used to the feel of it, the volume, and how it changes the dynamic of the conversation. By building this muscle memory, you ensure that in a moment of crisis, you won't even have to think about it. It will be an automatic, life-preserving action. This small bit of preparation can make a world of difference, allowing you to communicate effectively and act decisively when every single second is precious. Now, let's talk about another feature on your phone that is, quite frankly, a non-negotiable for every single person, especially seniors living alone: the medical ID. This digital file, stored right on your smartphone's lock screen, is your silent advocate. It can speak for you when you're unable to speak for yourself. If you were to lose consciousness before paramedics arrive, how would they know about your critical allergies, the medications you're taking, or who to contact? Your medical ID holds all of these answers, providing first responders with a complete, immediate snapshot of your health profile without needing to unlock your phone. It's a beacon of information in a sea of unknowns. Setting it up is one of the most important 5-minute tasks you'll ever undertake. On either an iPhone or an Android device, you can access the health or emergency information settings and fill out your profile. Be thorough. List every allergy, especially to medications like penicillin or sulfur drugs. Detail all your current prescriptions, including the dosages. This is critical to prevent dangerous drug interactions. Include your primary medical conditions, such as diabetes, high blood pressure, or a previous heart condition. Don't forget to list your blood type and your emergency contacts. This information is the key that helps emergency personnel provide the safest, most effective care possible from the moment they reach you. Think of Paul, a 76-year-old who we discussed earlier. While he was conscious enough to unlock his door, what if he had fainted just as the paramedics arrived? Because he had set up his medical ID, they would have instantly seen his allergy to a common blood thinner and his prescription for a specific beta blocker. This knowledge would have immediately guided their treatment protocol, preventing a potentially fatal error and allowing them to administer the right care faster. Your medical ID isn't just data, it's a direct line to your unique medical needs, a personalized instruction manual for the people trying to save your life. This feature is your safety net. It's the backup plan that works even when you can't. I urge you right after watching this video to pick up your phone and set up your medical ID. If it's already set up, review it. Is it up to date? Have your medications changed? Is your emergency contacts number still correct? Take a moment to ensure its accuracy. This simple act of digital housekeeping is a profound act of self-care and preparedness. It's a gift of clarity you give to your future self and the emergency professionals who may one day be by your side. Integrating these technological tools into your emergency plan is about embracing modern solutions to stay safe and independent. Using speakerphone and a medical ID isn't just for the tech-savvy. These features were designed with accessibility and emergency use in mind. They are straightforward, user-friendly, and profoundly effective. By familiarizing yourself with these functions, you are taking a proactive step to mitigate risk and enhance your personal safety net. You are building a bridge between your moment of crisis and the arrival of professional help, ensuring that the flow of information and support is never broken. This is about empowering yourself with the tools you already have in your pocket. Let's break down any barriers you might feel. If you're unsure how to set up your medical ID, don't hesitate to ask for help. A grandchild, a neighbor, a friend, or even a staff member at your mobile phone provider's store would likely be happy to guide you through the simple steps. Think of it as a collaborative effort to safeguard your well-being. Once it's set up, show your loved ones where to find it on your phone. Explain to them what it is and why it's so important. This not only reinforces your own knowledge, but also ensures that those closest to you are part of your circle of care. The combination of using speakerphone during the 911 call and having a complete medical ID is a powerful 1-2 punch. The speakerphone provides real-time, hands-free communication, allowing you to stay engaged and active in your own rescue. The medical ID, meanwhile, serves as your silent, comprehensive medical chart, providing a safety net of crucial information if your ability to communicate falters. Together, they form a robust communication strategy that addresses the dynamic and unpredictable nature of a heart attack. You are preparing for the best-case scenario, staying conscious and communicative while also being ready for the worst-case scenario. This step is fundamentally about harnessing the power of preparation. A heart attack is a disorienting and frightening event, but by deciding ahead of time how you'll use your technology, you remove guesswork and uncertainty from the equation. You create a clear, actionable plan. Using your phone's speaker and medical ID is not just a suggestion, it is an essential component of modern-day first aid. It's the digital equivalent of knowing CPR. It could be the very thing that speaks for you when you can't, ensuring you get the precise care you need as quickly as possible. We have now arrived at our seventh and final step, a technique that costs nothing, requires no equipment, and can be done anywhere, yet holds the profound power to stabilize your body's most vital organ. Step 7 is to slow your breath to steady your heart. When a heart attack begins, your body is flooded with stress hormones like adrenaline. This fight or flight response makes your heart beat faster and more erratically, which is the exact opposite of what it needs. A struggling heart muscle needs less demand, not more. By consciously taking control of your breathing, you can directly counteract this dangerous physiological cascade. This isn't just about feeling calmer, it's about tangible biological change. The practice of slow, deep, diaphragmatic breathing activates the vagus nerve, a massive nerve that runs from your brain to your gut and plays a key role in regulating your parasympathetic nervous system, your body's rest and digest system. When you stimulate this nerve through controlled breathing, you send a powerful signal to your brain and heart to slow down. This can help lower your heart rate, reduce your blood pressure, and even decrease the risk of a dangerous arrhythmia or irregular heartbeat, which is a common and life-threatening complication of a heart attack. Think of it as a biological override switch. Your body's automatic panic response is screaming, "Danger! Speed up!" But with your conscious mind, you can step in and say, "No, we need to be calm. We need to slow down." This intentional act of slowing your breath sends a message of safety throughout your entire nervous system. It tells your heart that, despite the crisis, it doesn't need to work so frantically. You are, in essence, becoming the conductor of your own internal orchestra, guiding your heart away from a chaotic rhythm and toward a more stable, sustainable tempo while you wait for help. This technique is your bridge. It is the crucial action you can take to keep your body in the safest possible state between the moment you call 911 and the moment paramedics begin treatment. It buys you precious, life-sustaining time. Frank, an 83-year-old widower, credited this very technique with keeping him stable. As he lay on his floor waiting for the ambulance, he focused solely on his breath, counting each inhale and exhale. He told doctors later that he could feel his racing heart begin to settle, a calming rhythm that cut through the terror of the moment and kept him grounded until help arrived. So, how do you do it? Let's learn a simple, powerful, and easy-to-remember technique. We're going to use a variation of the famous 4-7-8 breathing method adapted for this emergency situation. First, if you can, get into a safe seated or lying position as we discussed in step 4. Close your eyes if it helps you focus. Now, exhale completely through your mouth, making a gentle whooshing sound. Push all the stale, anxious air out of your lungs. This prepares your body for a deep, calming intake of fresh, oxygenated air. This first exhalation is the reset button for your entire respiratory system. Now, close your mouth and inhale quietly and slowly through your nose for a count of 4. 1, 2, 3, 4. Feel your belly expand as you breathe in, not just your chest. This is called diaphragmatic breathing, and it is the key to activating that all-important vagus nerve. Chest breathing is shallow and often associated with anxiety, while belly breathing is deep, grounding, and restorative. Picture the air filling your lungs completely, bringing vital oxygen to your body and your heart. This deliberate slow inhale is the first step in reclaiming control from the panic response. After you have inhaled for a count of 4, hold your breath for a brief moment. In a non-emergency, you might hold for a count of 7, but here we just want a gentle pause. A count of 1 or 2 is enough. This brief hold allows for a more efficient exchange of oxygen into your bloodstream. It's a moment of stillness, a pause in the cycle that helps break the pattern of rapid, panicked breathing. It's a moment for your body to absorb the calm you are creating before moving to the most crucial part of the exercise, the extended exhalation. Finally, you will exhale slowly and completely through your mouth for a count of 6. 1, 2, 3, 4, 5, 6. Make the exhale longer than the inhale. This is the part of the cycle that most powerfully stimulates the vagus nerve and activates your parasympathetic nervous system. It's the brake pedal for your racing heart. As you exhale, feel the tension leaving your shoulders, your jaw, your hands. Feel your heart rate begin to settle. Then repeat the cycle. Inhale for 4, a brief pause, exhale for 6. Continue this pattern until help arrives. This rhythmic breathing is your anchor in the storm. This breathing technique is a skill, and like any skill, it becomes more effective and easier to access with practice. You wouldn't wait until your house is on fire to figure out how a fire extinguisher works. Similarly, you shouldn't wait for a heart attack to try controlled breathing for the first time. I encourage you to incorporate this practice into your daily routine. Take just 2 or 3 minutes each day, perhaps when you first wake up or before you go to sleep, to practice the 4-count inhale and 6-count exhale. Let it become a familiar, comforting ritual. By practicing during times of non-stress, you are building powerful neural pathways in your brain. You are creating a calm reflex. When you do this regularly, your body learns the pattern and it becomes second nature. Then, if you ever find yourself in a high-stress situation like a heart attack, your body will know exactly what to do. Your mind will have a well-worn path to follow, a familiar tool to grab onto amidst the chaos and fear. This preparation transforms the breathing exercise from a desperate, fumbled attempt into a confident, automatic, and life-sustaining response. Think of it as an investment in your resilience. Every time you practice, you are depositing a little bit of calm into your physiological bank account. You are training your nervous system to be more flexible and better able to handle stress. This has benefits far beyond just emergency preparedness. Regular practice of slow, deep breathing can help lower your baseline blood pressure, improve your sleep quality, reduce chronic anxiety, and enhance your overall sense of well-being. It is one of the most powerful forms of preventative medicine you can engage in, and it is completely within your control. So, let this be your final piece of homework from our time together today. Practice this breathing. Share it with your friends and family. Teach it to your spouse. Make it a collective skill within your household. The ability to regulate your own nervous system is one of the greatest gifts you can give yourself. It is the final, crucial step in our plan. The one that empowers you to remain an active participant in your own survival, buying precious time and maintaining stability until the true heroes, the paramedics, can take over. You are not helpless, you are powerful. Surviving a heart attack when you are alone is a daunting thought, but it does not have to be a story of helplessness. It can be a story of preparation, awareness, and calm, decisive action. Throughout our journey today, we have built a powerful, 7-step survival plan that puts the control back into your hands. These steps are your shield and your strategy. From the very first moment of recognizing those subtle early warning signs, you are empowered with knowledge. You know not to dismiss that pressure or shortness of breath. You know that your body whispers before it screams, and you are ready to listen. From there, your plan unfolds with clarity and purpose. You know that your second action is your most critical. Calling for emergency help immediately, your unwavering lifeline. You know the life-saving potential of chewing a single aspirin to slow a deadly clot. You understand the profound importance of conserving your heart's energy by sitting or lying down, preserving every ounce of strength. You have a plan to clear the path for your rescuers by unlocking your door. And you know how to turn your own smartphone into a powerful communication hub and a silent medical advocate. Each step is a deliberate action that builds upon the last. And finally, you have the ultimate tool for managing the internal chaos, the power of your own breath. You now have a technique to calm your nervous system, slow your racing heart, and buy yourself the invaluable gift of time. These 7 steps, recognizing the signs, calling for help, taking aspirin, resting, unlocking your door, using your phone's features, and breathing slowly, are more than just a list. They are a declaration of your resilience. They are a testament to your commitment to your own health and your own life. Share this video. Discuss this plan with your family and friends. Preparation is an act of love for yourself and for them. Thank you for joining us today on Silver Inspiration. Your health journey is important, and you are never truly alone when you are armed with knowledge. Please comment below with the one step that stood out to you the most. Your insights help our entire community grow stronger. If you found this information valuable, please give this video a thumbs up, subscribe to our channel, and ring that notification bell so you won't miss our next video on vital health tips for seniors. Your engagement helps us reach and empower more people just like you. Stay safe, stay prepared, and we'll see you soon.